Today we're at McCawley Periodontics, and this is Mark McCawley, periodontist. Now, tell me, what is a periodontist?
I went to a lot more schooling to actually end up treating gum disease, doing dental implants, and also what's called periodontal plastic surgery, which is basically getting your smile looking great as far as the gum line and making everything look nice for you.
Right, so let's talk about gum disease. Let's start with that. What is gum disease and how many people have it? How would you know that you have it?
What periodontal disease is it's a bacterial and parasitic infection inside your gums.
Okay.
And once it gets into your gums, it makes a home. Back in 1990, this office got involved in using a laser. That light energy will actually go down to the base of the pocket, and it'll actually kill all that bacteria there.
Now, I'm no doctor, but this looks like it's bacteria of some sort up here.
Oh yeah.
You want to talk to us about what you have up here on the
So
screen?
that guy right there is an amoeba. You can actually get amoeba in your mouth. And those spiral-shaped bacteria, you can see basically hundreds of them. That's just a small little slice of what you can see around your mouth.
And then when somebody comes to see you, how quickly will they know if they have gum disease, and how quickly will they get it treated?
They come in, we do a full examination on all the patients. Right. We take a bacterial sample on all the patients too. If we think there's a chance you've got gum disease, we take a slide. So we've got a phase contrast microscope which actually is able to project this immediately.
Is there a way you could show us something like this?
Of course, yeah. Meet me by the microscope. Let's do it. Come on.
Doc, what are you looking at in there?
Well, what I'm looking for is periodontal pathogen bacteria and parasites. We actually end up projecting this, and we can show the patients exactly what they have. Those bacteria will get into your gums, and they will actually ulcerate your gums. And then you get the bleeding, which ends up precipitating bone loss and things like that. You end up getting loose teeth, and then you can actually lose your teeth because of it.
Not good.
And it's all because of those little guys.
That's
right there.
It's kind of scary. This is something that could also affect the rest of your health.
What happens is that bacteria, it gets into your gums. It doesn't stay there though. It actually ends up getting into your bloodstream. Right. It increases your risk of heart disease, stroke, Alzheimer's, even types of cancer it can increase the risk of.
What are ways that people can prevent themselves from getting gum disease?
Brush and floss regularly, use antiseptics, and in all honesty, get checked. Because once it gets to a certain point, no matter how much you brush and floss, it's not going to take care of it.
And the worst case scenario is that some people can lose their teeth if they let this get out of hand.
If you do have gum disease, our first choice is to try to save your teeth. But when that doesn't happen, if it's gotten too bad, and in places where you've actually lost teeth previously, we are able to replace them.
Dr. McCawley, thank you so much for your time. The next time we see you, let's talk about those implants. What do you say?
All right, will do.
Let's do it.
Thanks.